I'm Islip Town Councilwoman Mary Kate Mullen. I'm also a Bayport resident. I'm a working mother, and I have 3 teenagers. I'm also a neighbor, a friend, and a caring member of the community. Communication is important more so now than ever before. COVID-19 has resulted in social isolation, loneliness, depression, and an increase in opioid and heroin use. Encouraging the conversation about loss and addiction lessens the stigma of opioid abuse. It gives family members the opportunity to talk about their situation and helps them cope better by sharing their stories with others. I know from raising my own kids that once you start the dialogue, the information starts to flow. I'm urging parents and caregivers to start the conversation and to keep it going. Islip Goes Purple is designed to create awareness in our town, and it's also here to support family and offer resources that can help. You are not alone. We are one town. We are one Islip.
Hello, my name is Dr. Christopher Rayo, and I'm Chairman of Emergency Medicine here at Good Samaritan Hospital Medical Center, and I also serve as Chief of Emergency Medicine for Catholic Health here on Long Island. Good Samaritan Hospital's emergency department evaluates over 80,000 patients every year. It's a very busy place. We are an adult and pediatric trauma center. We are a comprehensive stroke center. We are a 24/7 cardiac center. But in recent years, we've also been encountering patients presenting with a very different illness, and that is substance abuse. Across our healthcare system, patients are presenting to our emergency department suffering from substance abuse issues related to opioids and other drug use. We really felt that this was an opportunity for our emergency department and hospital teams to engage the community and help combat this very, very important crisis. Substance abuse is a very complex problem. It is often associated with psychosocial issues and often stigmata related to the illness. What we felt was that we really needed to engage the community and our patients and really encourage the conversation not only with our patients but also with our medical team so that we could really figure out different ways to combat the crisis and different ways ultimately to help our community and these patients. What we have done here at Good Samaritan and across the whole entire healthcare system in our emergency departments is we've put into place several policies and processes to help these patients individually. One of the first things you need to do with really any disease process or any patient population is identifying the patient and the problem. So we have put into place an evidence-based approach where we screen patients presenting to our EDs so that we can first identify who is at risk and who actually is dealing with substance abuse at that time. The second thing is we have several policies in place where we have helped our clinicians to manage pain and ultimately prescribe less controlled substances, which has been highly successful across the entire healthcare system and which will also help combat this crisis. We have several procedures where we'll observe patients for a longer period of time, hopefully encouraging them to engage with the clinical teams and talk about their issues so that we can help connect them with further treatment and long-term care. Another thing we've put into place is our Sherpa Program. We're very proud of this program. We have partnered with Family and Children's Association, which is a community-based group where we actually have peer navigators who will come to the ED or contact the patients by a phone. And what their job really is to facilitate that warm handoff between the patient coming to the emergency department and them getting their treatment out in the community. And finally, we also partnered with Suffolk County to offer Narcan Packs for patients or family members who are concerned with an individual or themselves with substance abuse or opioid abuse, and they'll actually have the Narcan to go home with, and this could obviously be life-saving. Here at Good Sam, we really realize that this is a very complex problem. Substance abuse is a crisis across our country. What we feel is that it really needs a multifaceted approach to help combat this illness. The first step is identification and opening the lines of communication, not only with our patients and our physicians, but our entire clinical teams, our community, and we've actually partnered with the community to help fight this battle as well. This is not a simple problem, and here at CHS we have developed a multifaceted approach to help combat the problem, partnering with members of our community and organizations in the community to battle this crisis. Identification of the patients and really encouraging the conversation between the patients, their families, the clinical teams, and all the resources we have out there in the community is critical to combating this substance abuse crisis. We're very happy to be a part of Islip Goes Purple this month, as Islip and the town really helps to battle this big problem across our country.
Hi, my name is Kathy Koningsdorf. I'm the Executive Director of the JK Foundation, an Islip organization working for recovery supports for all of our community members. Part of the conversation in Islip Goes Purple is encouraging the conversation. We have to be talking about this subject. So today, that's what we're here to talk about, and I'd like to introduce Dorothy Knowles Johnson from Maxed Out Prevention.
Hello, my name is Dorothy Johnson, and I am an advocate. I've lost my son 10 years ago, and Islip Goes Purple is a very important initiative. Even though it is Islip Goes Purple, I am from Blue Point, and Islip and the town of Brookhaven, we are Bayport Blue Point, and we consider it two towns, one community. So I advocate in our community, and especially in the town of Brookhaven as well as Islip, to support those that have had issues with their families, their friends, and that are afraid to speak about it, because people hide behind closed doors and there's no support. And if we don't start the conversation and continue the conversation, nothing happens. We need to know that the shame and stigma is gone. You need to reach out and be there for somebody. Speak their name. Speak their name. That's one of the most important things that I need to say. As Islip Goes Purple, Brookhaven is going purple. And I want Long Island to go purple, because the more that we do, the more people that we reach, the more people that put a purple light bulb out. Chalk the walk purple. Let the children, dress in purple. Just to create the conversation. Why are you wearing purple? Well, it's International Overdose Awareness Day. Why? And unfortunately, COVID-19 has subjected people not to be social anymore. And it has affected so many people. The community needs to get together somehow to stop this epidemic, because it's getting worse. It's getting worse more because of COVID-19 and the disconnection that we have. We need to reach out more to the churches, to the schools, to our youth. Families go to liquor stores. The liquor stores are open. They're home, not working. Oh, let's have a glass of wine. What does this show our youth? It starts from something. Drinking, okay, the youth see it, okay, then they go on to smoke pot, and too much freedom, not enough socialization, and things happen. And the end result is death. And if we don't talk about it and reach out, then that's the end result. And we don't want that. So we continue to raise awareness on Islip Goes Purple. Throughout Long Island, throughout New York, we're going. Go purple.
When we talk about the conversation, there's a very common phrase in the recovery world called, "We're only as sick as our secrets." And to recover, we have to acknowledge our pains, acknowledge our challenges, acknowledge everything about ourselves to be able to recover. What happens, unfortunately, is sometimes our person may recover, but we are not getting our secrets out. We are not talking about our stresses. We're hiding from our neighbors. We're hiding from our co-workers. We are living in this very quiet, still, isolated place. And I have to agree with Dorothy. COVID-19 has sent this completely off the chain, what's happening right now. I personally know 12 people that were in recovery, could not handle the anxiety of the separations, that have purposely or unpurposely overdosed and died. Some of them as young as 22 years old. And those families are suffering. Those families, knowing that their person is struggling again, is suffering. We don't make eye-to-eye contact anymore. A Zoom meeting or any kind of webinar does not give us personal interaction. And I understand the safety of it, and I wish they had never called it social distancing. It's physical distancing, but we need to socially connect. We need to let people know they are not alone. They don't have to go through this alone. There is no anxiety. Islip Goes Purple is that piece. It is that connection. It is that way to bring the conversation forward. The conversation needs to be about addiction and substance use disorder. The conversation needs to be about recovery. The conversation needs to be about the family struggle. The conversation needs to be with everyone, from our youngest to our oldest people. It's okay to say you are in pain, you are suffering, you are living in fear. Every time you tell somebody your story of what's going on with you, you allow that other person to exhale their anxieties, their pain. Even if it's for 5 minutes, you've just given them a respite. Encouraging the conversation is the answer to a socially huge, multifaceted problem we're having around the substance use disorder. I encourage everyone, talk to somebody, because you step out of your anxiety and they see that anxiety when you go to say something to them, you just gave them the open window, the opportunity to share, the opportunity to come out of their own suffering. And if everyone would do that with somebody, we would have so many less people behind doors, so many less people suffering alone. Because we recover, when people recover, whether it's from your own personal substance use disorder or loved ones, we recover together. Isolation is the petri dish for pain, anxiety, and addiction. So let's stop that. With Islip Goes Purple, let's increase the conversation. Everyone should be able to talk to somebody about what's going on for them. Thanks.
I would like to add that this isolation, as Kathy mentioned, has had such a major impact. And by going purple, we hope that it will increase awareness and that people will acknowledge the fact that they're not alone. They can't be ashamed. The shame and stigma has to dissipate. People are hiding behind closed doors, and unfortunately, they don't come out until it's too late, until they've lost somebody, and then they will speak up. And so many people, when they've lost somebody, they won't even have a funeral in their local town because they're ashamed. It's devastating. It's just devastating. I pledge that we will work as hard as we can to create the biggest Go Purple throughout Brookhaven Town and Islip Town. Thank you to Kathy for creating this event. Last year was the first time that it started in the town of Islip. And with the Great South Bay Coalition, we move forward. And as myself, as an advocate, after losing my son, I have reached out to Brookhaven and many other communities and townships to go purple. Last year, 39 countries went purple. This year, we need more. And we need more here on Long Island because it's an epidemic, just like COVID-19, and it's causing a worse situation. So please, go purple, acknowledge your neighbor, and remember, you're not alone. You're not alone. Thank you.
Today is August 21st. 4 days from now, August 25th, my oldest child should have been celebrating his 29th birthday. Jake has been gone since 2013. He died at 21 from a heroin overdose. Back at the time we were suffering with it as a family, we suffered for about 2.5 years. We went to doctors, we went to psychiatrists, we went to psychologists, we did everything. But there wasn't one person in the community that was willing to walk up to me and say, I know how this feels. I know the journey you're on, and I'm here to support you. In those 7 years, I have done everything I can to increase the conversation, because I wish I had the availability of the conversation that exists today. There are free resources all over Long Island. You don't need to identify to go into them. You don't need a doctor's prescription to go into them. You just have to ask somebody, where is the conversation, if you don't know. I know so many support groups of all different types. There's so many pathways to our own recovery from what we're going through. And I'm going to do everything I can to be part of that conversation that continues the conversation that didn't even exist 7 years ago. We've done so much, but it's not enough. We have to do more. We can do more. We owe it to ourselves, and we owe it to our community to increase this conversation so nobody suffers.